Good morning, everyone. My name is Yinglo. I'm a student in HIT program. Today, my presentation is Introduce Healthcare Data Sets, OASIS, HEDIS, DEDS, and UHDDS. As we know, in every healthcare setting, there is a data that is collected and stored to be used for a lot of reasons, such as patient care, reimbursement, and research. Just to name a few, from the collected data, datasets are created. Datasets are used in all types of healthcare settings and are used to identify the data elements that are collected on each patient and to also define common terms used in that dataset. The datasets I will discuss today are UHDDS, OASIS, DEDS, and HEDIS. In this presentation, we will know what is healthcare data sets, purposes of healthcare data sets, introduction of OASIS, HEDIS, DEDS, and UHDDS. So finally, we will know benefit of healthcare data sets. First, we should know what is healthcare data sets. To be simple, that is a list of recommended data elements with uniform definitions. A dataset is a standard method for collecting and reporting individual data elements. Each healthcare facility develops a data dictionary, which is a collection of data element definitions. The datasets used for collection and reporting purpose depends on patient types. So there is a lot, but today we just discuss 4 of them. So we should know purpose of healthcare datasets. This is to identify the data elements that should be collected for each patient and to provide uniform definitions for common terms. The first one we discuss is OASIS. OASIS is Outcomes and Assessment Information Set, a standardized data set designed to gather data about Medicare beneficiaries who are receiving service from a home health agency. It includes a set of core data items that are collected on all adult home health patients. It's sponsored by the Healthcare Financing Administration. This dataset includes a set of data items collected on all adult home health patients. Data are used to assess the outcome and measure the quality of the healthcare service given to the patient. The second one we discuss is HEDIS, Health Plan Employer Data and Information Set. This set is a set of standard performance measures designed to provide healthcare purchasers and consumers with information they need to compare the performance of managed healthcare plans. Administrative, claims, and health record review data are collected. This set, sponsored by the National Committee for Quality Assurance, standard performance measures designed to provide purchasers and consumers of healthcare to compare managed healthcare plans. The information collected about special health related conditions is used to analyze and assess outcomes of treatment. One of the goals of HEDIS is to encourage the performance improvement for health plan and practice. That is why HEDIS developed the physician profile. For example, diabetes care or smoking cessation programs, breast cancer screening bank, like this. Okay, the next one is DEDS, Data Elements for Emergency Department Systems, a dataset used to support the uniform collection of data and hospital-based emergency departments, and to reduce incompatibilities in emergency department records. So, DEDS is developed by the Centers for Disease Control and Prevention and the National Center for Injury Prevention and Control. DEDS recommends the collection of 156 data elements organized in 8 sections. We should know this. The last one we will know today is the UHDDS. This one is Uniform Hospital Discharge Dataset. Lists and defines a set of common uniform data elements for every hospital inpatient. Includes principal diagnosis, principal procedure, and other significant procedures. This set developed in 1969 Conference NCHS, National Center for Health Service and Research and Development, and Johns Hopkins University. All short-term general hospitals in U.S. must collect minimum set of patient data element UHDDS. So after we know these 4 data sets, we should know benefit of healthcare data sets. I'm trying to be simple to introduce this. One is improved communication between healthcare professionals. Another one is improved patient outcomes. The third one is early interventions due to early detection of signs and symptoms. So this presentation, we just want to know, as the health care system continues to grow and become more complex, the healthcare IT system demands comprehensive solutions to promote data standardization. Health data provide comparison for clinic studies, can be used to assess costs of healthcare, can help identify needed prevention targets for such programs, and are important for program planning and evaluation by finding a baseline against which to measure in the evaluation phase. So this is my presentation today. Hope this simple introduction can let you know some information about these data sets. I researched online. There are a lot of details and information about data sets. If you are interested more, you can search online and get more information. Thank you so much. Have a good weekend.